Okay, everyone, we had a little technical problem and everything, but again, I tell you, in West Virginia, you know, there are signs of real improvement. You know, I very, very regretfully have got to tell you that we lost another 13 people in West Virginia. But just think, you know, there was days just a few days ago when I was reading 83 names, 77 names, 72 names, over and over and over. We've got 13 back-to-back, and before that, you know, we had, I think, in the 20s. You know, one day, I do believe it jumped up to 40. But it's better. It's still tragic. It's tragic in every way. We've lost 2,225 people in this great state. And just think about this just for a second. I go back to Sago over and over. 12 miners. One survived, I think. It's been a good while ago. We lost 13 since Monday in West Virginia with this dreaded killer. But praise the Lord, it's only 13 compared to where we've been. So if I could read these great people that we've lost there, I can't read their name, but I can tell you their gender, and I can tell you their age, and I can tell you what county they're from. And I hope and pray that the people that are close to these people and love them with all their soul know that I love them too, and all West Virginians do too. And you're not alone. You're not going to be alone. The 2,213th death is a 78-year-old male from Berkeley County. The 2,214th death is a 64-year-old male from Webster County. The 2,215th death is a 76-year-old female from Raleigh County. The 2,216th death is a 77-year-old male from Kanawha County. The 2,217th death is a 66-year-old female from Mercer County. The 2,218th death is an 83-year-old female from Wyoming County. The 2,219th death is a 90-year-old female from Fayette County. The 2,220th death is a 79-year-old male from Taylor County. The 2,221st death is a 95-year-old male from Harrison County. The 2,222nd death is an 80-year-old female from Greenbrier County. The 2,223rd death is a 70-year-old male from Grant County. The 2,224th death is a 68-year-old male from Grant County. The 2,225th death in West Virginia is an 83-year-old female from Wayne County. Many, many, many prayers. I've said it over and over. These people are not numbers. They're not statistics. These people are great West Virginians. They have family and friends that love them, and we do too. We thank them for all that they've given us in West Virginia, and we'll miss them. Our numbers in West Virginia continue to get much, much better. We have had only 289 positive cases in the last 24 hours. That's way down. Our daily positivity rate is at 3.14. That's way down. Our cumulative rate continues to inch down. It won't come down quickly. It's at 5.54, but that's much better as well. We have active cases of 10,522. We're on the verge of dropping below 10,000 in our active cases, and it is the 32nd straight day in a row that our active cases have decreased. We have recovered cases of 115,658. Pay really close attention to those two lines on the top, and the wider they get, the better off we all are. The light green is recovered, and the light blue is recovered, and the dark blue is the active cases. We want the actives to go down and the light blue to continue to go up. We have 320 people hospitalized in West Virginia and 74 in the ICU units, and no red counties. You know, and so please show our map. Isn't that beautiful? Isn't it absolutely beautiful? It would be even more pretty if it were all green, but isn't it beautiful? Isn't it beautiful to see a county in the Eastern Panhandle going green? Isn't it wonderful beyond belief and beautiful to see a county in the Northern Panhandle green? And it's just great. I mean, that's just all there is to it, and we're just really happy about that. A reminder, if you're 65 years of age and older, please, if you feel the least bit sick, please go get tested. The antibodies are waiting on you, and they'll absolutely save your life. I've got to tell you this, that we're meeting again with our pandemic teams, and we've been in a bunch of discussions with the superintendent of schools, and we'll have more today and more tomorrow. And I hope to update you on just this on Friday regarding some ideas to lessen the restrictions on our businesses and on our schools, and make a better move forward on our schools as well as our businesses. You know, I think we can move in that direction now, and on Friday I'll be releasing more information on that to back off restrictions maybe on our restaurants, you know, and to some degree, and absolutely from the standpoint of this blended schedule and things like that we're working on with our school systems. On a vaccine update and everything, on the distribution update, you know, for this week, we are already at 97.2%. It's Wednesday. You know, we're at 97.2% of the on the administration rate for first doses and 98.9% on the second doses. You know, for both doses, right now, we're at 94% for the week. But by the time we get to the end of the week, we'll do exactly what we could be done over and over that astounds the nation in every way. And that is, we will run past 100%. You know, to date, we have given doses to almost 400,000 people in the state of West Virginia. 398,635 doses, unbelievable. Fantastic. We have saved a bundle of lives, and that's really great stuff. We continue to lead the nation over and over, you know, thanks to our partners on the local, the county level, all of our communities, the National Guard, just the DHHR, all those in the health community. Thank you, thank you, thank you, because you have been fabulous. You know, from the standpoint of Walgreens, we do have a deduction. We really anticipate we're going to get 7,300 doses. We're going to be receiving 5,800 doses, and we're very, very, very hopeful that that's going to continue to move up. There are rumbles in the jungle that we're going to get another 7,000 doses, and absolutely we thank our congressional teams. We thank everybody that's working on this. For crying out loud, I will promise you this, that all those in Washington are hearing from West Virginia in every way to push more and more vaccines to the state that learned how to do it and do it right with all the help of the great people of West Virginia. So thank you. You know, the vaccine scheduling system, that's where you pre-register and everything, and absolutely that's working just great. We still are asking these counties. Evidently, Monroe really stepped up their game. We thank them for that. But Gilmer, Wyoming, Mingo, Mason, and McDowell counties, we absolutely need you to get pre-registered. It will absolutely make things so much easier and facilitate you being able to get your shot. So absolutely, come on now, get yourself pre-registered. And it doesn't automatically mean that you're going to get your vaccine tomorrow, but it enables us to schedule and put you in the works to be able to get your vaccine. Don't wait. Don't wait, West Virginia. We have now 261,000 that are registered. That's great, but it ought to be hundreds of thousands more. So come on, West Virginia, get yourself registered and everything, because that is really, really important to being able to get you the shot. And if you can't and you don't know how to do it, all you got to do is call somebody. Call one of us. Call one of us. We'll help you through the whole pre-register stuff and everything and get you done. It only takes about 10 minutes. It absolutely doesn't cost any money whatsoever. Please just call us and let us get you pre-registered. As far as our Saving Our Wisdom clinics, again this week, the clinics are in all 55 counties. There's a full list that is available on our website. You need to we all need to be concerned about this storm that's coming, because, you know, I do believe it's wintertime in West Virginia, and we haven't experienced a whole lot of snow in the last couple of years, but that's what it is. I mean, you know, we're we've all grown up and been, years where we had a lot of snow, and it's beautiful beyond belief, and we surely need the snow, and it will help in lots of ways, in groundwater and everything else. But I'll get to that storm in just a few minutes. We continue with, to pull names from the West Virginia COVID vaccine registration program to fill out appointments after wait lists have been exhausted. We've still got a lot of clinics that are working on their wait list, and they're going to get those exhausted. That's great. But pre-registering only helps them and helps us as well. I've got to tell everybody, I've told, everybody this, we can only do what our resources allow us. And by resources in this situation, I mean the number of vaccines that we have. We will give out every single vaccine we have, but we can't absolutely manufacture more vaccines. All we can do is just keep pushing the federal government and everything, and pushing as hard as we possibly can to get more and more vaccines into West Virginia. I always talk about the proudest number. The proudest number that I can think of today, and it's been this way for several days, is just this. We pivoted and we said, by dog, we have got to get shots in the arms of people 65 and older. We started with 80, if you'll remember. And we got to do it now, because those are the people that are dying. And we got to do it right now. And West Virginia got it right. West Virginia absolutely got it right. We put those vaccines where our people could get them in the local pharmacies and local clinics and everything, and we got them to those people. Today, we have gotten to those people, and we have vaccinated 137,356 people in the state of West Virginia that are 65 and older. And 63,753 have been vaccinated the second time. Now, I'm telling you, I read this every day. That move saved a bunch of lives. And so that number is a number that I continue to watch and continue to smile about and feel absolute warmth in my heart, because we made a difference that day. That's what I'm here for. And that's what these great experts are here for. And we made a difference that day. And so I thank everybody involved, and really and truly, that's good stuff, good stuff. Our vaccine info line is up there. A reminder, please get your vaccine. Please take a shot. It is absolutely painless, and over, you're not going to get COVID from taking the shot. You're not going to grow antlers or another hand. Take the shot. That's all there is to it. You see the results of what we've been reading every day. Take the shot. Absolutely, you can't tell me of situations that are numerous where people have taken a shot and had adverse effects beyond belief. You're not telling me that, because absolutely it's not happening. Take the shot. As far as our testing, we've got all the free testing still going, and go get tested especially if you have any anxiety or any problems whatsoever, get tested. We want to thank the drive-through people, from the standpoint of Fruth and Walgreens. Great work, way to go. We're down to 25 outbreaks in our long-term care facilities. It's phenomenal. We have still one outbreak in our church community, and that's still in Fayette County, and I hope to goodness we'll get that all cleaned up real soon, to where I can announce to you that we don't have a single outbreak in our churches. But what great work they've done. Oh, man. And the same for our assisted living. It is amazing to think that assisted living today in West Virginia, we have 25 outbreaks. Really? Just think about this, how good that's been. To think in West Virginia we have one outbreak in our church community. Are you kidding me? Are you kidding me? It is absolutely phenomenal what they've done. But think about this too. In corrections today, we have 20 inmate cases across our whole state. There were 43 on Monday. We've cut it in half since Monday, but 43 is almost nothing. It is absolutely just great. We have 3 staff cases now. 12 inmate cases are at North Central, and the rest of them are just spread out. Just think about it. Think about the good work that everybody's doing. I say it all the time, but it's just so true. And really, we as West Virginians, you know what the beauty has been? The miracle has been just this. We stayed together. We've pulled the rope together. In all honesty, you have flattered me and honored me beyond belief because you've trusted me. And I've delivered. I've delivered on that trust. I couldn't tell you good news every day because it wasn't good news. I've told you the truth, and I'll continue to do just that. I thank you for entrusting in me to do that, and I'll continue to do that. Our face coverings, wear your face coverings. It's your number one thing of defense. I ask you over and over, if you've been blessed by recovering from COVID, give blood. Give blood. It to me seems an obligation. So if you can do it, please consider it and do it. Yesterday I declared a state of emergency in Cabell, Lincoln, Putnam, and Wayne counties due to the severe winter storm that has caused numerous power outages and road blockages over the past week. I also declared a state of preparedness for the remaining 51 counties due to the severe storm that is expected to cause additional outages and road blockages throughout West Virginia. The winter weather precautions or preparations are just this. There's a winter storm warning that is happening right now for most of the state tonight through Friday morning. It is expected to put down heavy, wet snow that will cause additional tree damage and power outages. I have asked my emergency management division to continue to be on high alert to coordinate and respond to this storm. And if you have an issue, please call 211, not 911, 211 if you need information on different things about the warning situation. Our Department of Highways is working around the clock to be ready for the storm. The salt sheds have been replenished and they're full. Our snowplow drivers will be working 12-hour shifts. So really, if you're out on the road and you see a snowplow that's doing great work, don't crowd it. Don't run right up on it. These guys are doing a phenomenal job, and ladies, and you've got to be really respectful and cautious and try to help them do this great job. Crews will be on the road before the storm hits, during the storm, and after the storm until all the roads are cleared. When you see a snowplow, do exactly what I've already told you. Stay 100 feet back and respect the fact that those people are really trying to help you. Now, one last thing I got, and that is just this. It's going to get really cold, and we're going to have a lot of snow. And people are going to lose power. And your neighbor may be sitting over there and no one to check on them. Now come on, West Virginia. Check on people and step up again. I know you will, but we can't have neighbors and everything there, and elderly especially, with nobody checking on them. So please, just step up, hold your hands together and everything, and join everyone in pulling that rope, and step up and try to help your neighbors and help any and everybody across this great state. We'll get through this storm. This is just a blip on the screen. It won't be any more than that. Don't be afraid. We'll get through the storm, and then there'll be another storm, and we got to handle that and get through that too. But in all that, the way we get through is we all have our hands on that rope, and so call your neighbors and do all you can to check on everybody. That's all I got for right now. I thank you again, and I love the fact that we're getting better. Keep it up, West Virginia. Good work.
All right, thank you, Governor. Let's now go to retired Major General Jim Hoyer, the Director of the Joint Interagency Task Force.
We continue to make good progress this week moving forward. We'll be managing and have already managed challenges with weather. Folks, please need to understand that weather impacts not just the distribution into the state, but the distribution out to our hubs, as well as clinic times and availability. So please pay attention to those changes that are posted related to clinics. And then we'll also be managing where individuals may not be able to show up to a clinic to make sure that we get doses in other arms to make sure we maximize the use of all of our doses going forward. As the governor pointed out, we'll see an increase next week in doses. So we'll be managing the distribution of that. Again, our focus is on over age 65, as well as our critical workforce over age 50 as we begin that rollout as well. This morning, you'll see an additional tab in the dashboard that DHHR has been able to put up that focuses on individual counties. We've had a lot of questions about counties, concerns about inequities of distribution in counties. Please understand that early on in our process, based on our 4 principles, our focus was on healthcare workers and nursing home facilities and nursing home staff. So where there were concentrations of those facilities, you're going to see greater concentrations initially in the per 1,000 doses that have been administered. I want to make sure that people understand, and I've been at this a long time and been at this with the governor through his first term. We are focused on all of West Virginia, but we are focused on our principles, and that is going to impact our numbers initially. And the people in the GIADF represent all of West Virginia, and we'll continue to focus on that. But we know, based on what we have done and our strategy that the governor's focused us on, as Dr. Marsh pointed out recently, we have almost a 70% reduction in deaths in this state over the first 6 weeks of 2021. So we've got to continue to focus on that path. I want to also highlight how this will work going forward with our registration system. As the governor pointed out, over 137,000 West Virginians over the age of 65 have received a dose of the vaccine. We know that in West Virginia, by our census data, we have 367,000 people. We estimated initially that about 275,000 of those would take that, about 75%. That leaves us around 136,000 West Virginians. But today, we already have 109,000 West Virginians in our registration system. So if we can continue to press to get the rest of those West Virginians over 65 registered, and we now know where we need to focus those 109,000 doses to get those numbers where we need to be. And today, we also know that only 320 West Virginians are in the hospital with COVID. So I ask folks to continue to be patient. We will continue to focus. The governor continues to press us, not just on our principles, but on being transparent. And that's why we put those numbers up going forward. Thank you.
Great, thank you, sir. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. Good morning. I will be brief, but I want to reinforce what the governor said and what retired Major General Hoyer just told us. You know, with the strategy that we've taken to vaccinate our most vulnerable part of our population, both being first in the country and immunizing our nursing home residents, and now very aggressively immunizing our over 65-year-old citizens, as the general said, we have reduced the number of deaths from the first week of 2021 to today by almost 70%. That is just phenomenal. So good. And while I know everybody who is waiting for their turn to take the vaccine is anxiously awaiting that movement so that they can be able to be chosen, that it is really, really outstanding that we've been able to do this for West Virginia. And thank you, everybody who's had the patience and the altruism to put others in front of you. And as General Hoyer said, that we've also seen a really dramatic reduction in hospitalizations. But the important thing about all of this, and the governor did mention this, is it is not the time to let our guard down. So it is even more important right now with viral variants and other issues that that are starting to, expose themselves as part of the COVID pandemic. As we watch around the world, we have to be very, very diligent as far as wearing our mask and staying physically distanced. We also are very proud of the lower number of outbreaks in churches and schools. And we just had the opportunity yesterday to meet with faith-based leadership. And it is so important that we're working hand in hand together with each of our communities and our faith-based leaders to make sure that we are both identifying the correct population, our priority groups to be vaccinated, and also to make sure that we are serving all other people in our community so nobody is left behind. And then as the general said and the governor said, it is so important for us to get everybody registered in the state's pre-registration system so that we know everybody in the state, and we can start to make sure that when it is your turn, when your priority group comes up, then we're able to identify you and give you that opportunity to get vaccinated. And when you do have that opportunity, we very much hope and encourage you to choose to do so. So thank you very much, and well done, West Virginia.
All right, thank you, Dr. Marsh. Next to Secretary Bill Crouch with the West Virginia DHHR.
Good morning, everyone. We are very pleased to announce a rollout of the revisions to the DHHR dashboard. These revisions do include now county data. We've been working hard to try to make sure we get that information out to you as quickly as possible. We've had a lot of requests for that information. This information will show the total doses received in the state, as well as the breakdowns of age, race, and gender by county. So there will be a map, and I believe Jordan's put that up on the screen. There is also a 3-minute tutorial for those who would like to click on that and get a quick look at how this system works. We have tried to make it very intuitive, and much like the previous map or the other map on the dashboard. We're appreciative of the folks at DHHR. We have some terrific people there. Tim DeBar especially has spent day and night working on this to try to make sure we roll it out as quickly as we could. And we thank him for all of his efforts on that, as well as others involved in this. This is part of our commitment by the governor to be transparent and to make sure we provide information as quickly and in the best manner we can. As with any rollout, if there are any bumps in the road or glitches, please let us know, reach out, and we'll make sure that we correct those issues promptly. So look at the tutorial, look at the map, and that provides information that you've been asking for. Thank you.
All right, thank you, sir. Next, Dr. Ayn Amjad, our State Health Officer, is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Kenny Bass with WCHS and Fox 11.
Hi, thanks for taking the question. Dr. Marsh touched upon it a little bit in his statement about meeting with the West Virginia Council of Churches and considering where to place certain people in certain populations on the list. I've been contacted by several daycare providers in the past couple of weeks, and they were wondering about the federal recommendation that daycare providers be placed on the essential worker list, but West Virginia thus far has chosen not to take that step. Dr. Marsh or Dr. Amjad or Governor Justice, whomever feels comfortable answering the question, is there a possibility that that could be changed or accelerated and daycare workers could be put on the essential worker list, since obviously if teachers are going back to school and government workers are going back to the Capitol, then there's going to be the continued need for daycare services? Thank you.
Clay, I think you can jump in on this, but now don't hold me to this because I don't know this absolutely for certain, I don't think, but I know that the daycare workers in my executive order are essential, but I don't know that absolutely. But Clay, maybe you can answer, because if they're not, we should move them there. But I think we've already got them there. But anyway, Clay, go ahead.
So thank you, Governor, and thank you, Kenny. So we know that that young children transmit COVID much less well than older children and adults. We also know that we've had very few outbreaks in our daycares. But as I understand it, that the daycare workers over 50 years old would be part of that initial group that we've talked about from an education standpoint. And then daycare workers that are under 50 years old, like we've talked about for K through 12 teachers, and other essential workers under 50 will be part of our phase 2B, which is coming up after we serve the over 65 population and then start to deal with some of these pre-existing health conditions.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. My question is for Secretary Crouch. This may be explained in the tutorial you mentioned, but could you explain exactly where that vaccination information is coming from and how it's transmitted to the DHHR? And how often is this going to be updated? Is this going to be daily like the rest of the dashboards or weekly? Thank you.
Yes, thank you, Charles. Governor, okay to go?
Oh, please go, please.
Yeah, thank you,
Brian.
Charles. That's a good question. The information that we've provided at the top of the screen comes directly from the GIADF, and it is updated daily. What we have simply done is take that information and base that on a county, place that in county buckets, as the governor says, so that we can look at that information in more detail. We had difficulty getting information from the feds, as I mentioned one time, just simply a glitch from the standpoint that we couldn't get access to the VAM system ourselves from the feds, but we now have that. And we can then take the same information at the top of the screen and provide that at the county level. As you click on a county, you'll see that information broken down by the same categories of age, race, and gender. So the information comes to the GIADF daily, will be updated daily.
All right, thank you, Charles. Next, we'll go to Mark Curtis with Nexstar Media.
Good morning, Governor, and good morning, cabinet members and fellow press members. Governor, this morning I got a call from a woman, a very desperate woman in southern West Virginia. She was of the understanding that either in the first or second CARES Act, there was significant money provided so that for opioid treatment in addicts, especially in this time. And she has been trying to get a family member who is addicted into treatment and has been unable to. And for Secretary Crouch, I'll send Allison Adler the name and all the information on this person. But they're trying to cut through the red tape. They're very concerned that there was some federal money provided for opioid relief, and they aren't able to access it or treatment.
Okay, Secretary Crouch, this has got to be you, sir.
Yes, thank you, Governor. Thank you for the question, Mark, and please push that information out to Allison so that we can follow up. There was not money in the CARES grant for SUD, but we do have other federal dollars and state dollars available for that. So I'm sure we can provide some assistance and provide some help if we get the follow-up information on that. So thank you for that.
All right, thank you, Mark. Next, we'll go to Kelsey Soto with WSAZ.
Greetings from very cold, very tired and frustrated Western West Virginia, who's been hit pretty hard with these storms the last few days. Whoever wants to answer, we're seeing a lot of these vaccine clinics getting canceled, either because the staff can't get there to host them or the residents aren't able to travel and get to these. Are we at all worried about the trajectory of, the progress we've been making on vaccine rollouts? Is there a chance that these vaccines could go bad? And then is this going to hurt those in that second doses? Obviously, the weather is an act of God, but also, we're fighting a pandemic. So just, maybe some advice or recommendations on how we can not lose the progress we've been making.
Well, General Hoyer, I think it's going to have to be you, sir, but at the same time, we're not going to lose the progress, and we're sure not going to have vaccines go bad. And I hate like crazy all the stuff that's going on in the western counties in West Virginia because, I've been there many times, power out and things that, are surely really burdensome. And so please take care of one another and let us know when and where we can help in any way because I've been there and I know what it's like to be in a house that doesn't have any power in it for days, and that's tough stuff. Hours is tough, but days is really tough. So just know you've got a lot of friends that'll run to the fire and everything from our end, and we're gonna do everything and anything we can to help those great folks. And we hate like crazy. We've got another storm coming, but we'll get through it. We'll get through it. But General, if you could talk about the vaccines and protection of the vaccines and all the stuff.
Yes, sir, Governor. So, Kelsey, the battle rhythm in the interagency task force is they meet 3 times a day to coordinate efforts such as this. They're in constant communication with local partners. So we will have a plan that will, if we need to, move vaccines to other locations. And then next week, backfill the vaccines that would have come to those counties. That's one option. There are a number of different things, and it will depend on each individual county how it's worked out. But rest assured that staff is working that. Governor's given us good, solid guidance, and we'll continue to press to get all of our vaccines out and do it safely.
All right, thank you, Kelsey. Next, we'll go to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. We haven't talked about colleges and universities for a while. I know when they were coming back after the first of the year, there was an emphasis on increasing testing and the like. And apparently, since we haven't had a surge, they've done a pretty good job. Am I reading that wrong?
Okay, Dr. Marsh, maybe you could jump in on that. I think really and truly it's, by doing the testing, by doing all the different things we're doing, on our higher ed level, we've got really wonderful results. But I'll let Clay, who's an expert beyond me, to be able to report.
Thank you, Governor, and thank you, Paul. So absolutely, I think that the extensive testing program that the governor approved for the higher education schools and the work of the Higher Education Policy Commission with Chancellor Tucker and Cynthia Pursley have been really powerfully effective in identifying people with COVID-19 and isolating them right away. We do know, though, however, that maintaining appropriate mitigation measures, mask wearing and physical distancing and all the other arrangements that the higher education part of our school system has made a big difference as well. And just like we've talked about for the rest of the state, it's really, really important that in addition to testing, that we maintain very stringent commitment to these mitigation measures. And from a study at WVU with the CDC, we saw last year, about 85% of our students on campus were wearing their face coverings and appropriately doing the mitigation measures. And we need to make sure that all students in higher education do that on campus, but also off campus, to be able to continue to keep schools in person for teaching and keep everybody safe.
All right, thank you, Paul. Next to June Leffler with West Virginia Public Broadcasting.
Hello, thank you for taking my question. I would love if I could get just a rundown of the weekly vaccine doses that we're getting. You mentioned there's an extra 7,000 from the feds, but could we get like a total number? And if the feds are actually giving us more than that 7,000, like if they're actually giving us plus because of the pharmacy program, just lay that out for me. Thank you.
General, this is you, sir.
Yes, sir. So as the governor pointed out a while back, our baseline was 23,600. That moved up recently to over 30,000, then to 33,000. And next week, with the totals that we will get, we will be just short of 41,000 doses for the week. I believe it's 42,000 or 40,600. So we continue to see steady progress and growth. As the governor pointed out, he continues to press daily we continue to press as his leadership team, and our congressional delegation has been very helpful in pressing as well.
All right, thank you, June. Next, we'll go to Mark Craham with WDVM.
Well, good morning, and congratulations on the great success that West Virginia's had. It's also good to see that the vaccinations distributed tab has been added to the website. Here in the Eastern Panhandle, we've had quite a few questions from residents regarding inequity, some of the things that the General Hoyer was talking about earlier. And perhaps you could discuss a little bit of the methodology in how the distribution of the various doses is done to the various counties across the state.
Well, thanks so much, and hello up there in the Eastern Panhandle too, and everything. We want to congratulate you on all the unbelievable goodness that's going on in the Eastern Panhandle, and know we're right with you, arm in arm. But General, you got to answer this, sir.
Yes, sir, Governor. So we take the weekly allocation. We have to pull out from that weekly allocation a certain number of doses that go to our healthcare facilities for new workers who come into facilities. And I give you an example. I believe if you look, and Clay can help me with this, WVU Medicine, I think, hires 100 new employees every week in the healthcare system. So we also have doses that we now manage that go to our new residents coming into our nursing homes and assisted living facilities, as well as new employees. And then we have a certain number that will come out for other specific populations. From that baseline number, then we break them out by percentage of population per county over the age of 65. And I want to go back, and I know there are a lot of folks in the Panhandle that have questions and concerns, but I would just take, for example, nursing home population. I think in Jefferson County, nursing home population around 220 some folks versus Kanawha County, where a nursing home population is over a thousand some, almost 1,100. So as you can see early on, by focusing on populations, we are certainly going to have differences. Number of healthcare workers, look at, again, Kanawha or Mon County that have Mon Health System and the WVU Health System, CAMC and Thomas, and the Eastern Panhandle. So we understand that folks are concerned about that. But again, you got to go back and look at the priority focus that got us to those numbers of that almost 70% reduction in deaths, and as well as the reduction in hospitalizations. And I would ask the folks in the Panhandle, continue to press us. The governor presses us every day, and we'll continue to make sure that we get doses to all of West Virginia.
All right, thank you, Mark. Next, we'll go to Matthew Young with the West Virginia Daily News.
Hi, good afternoon. I was hoping you could expand a little bit on the information that came out yesterday regarding the Game Changer program. Governor, you have been a head coach here in Greenbrier County for some time, and as someone that's had a reasonable amount of success in that area, I'm curious how does that experience translate into your role as the head coach of Game Changer? The program is growing, it's becoming more successful. Obviously, the partnership with Hazelwood and Betty Ford opens a lot of doors. Also, yesterday, the AG's office announced that the Kids Kick Opioids contest is rolling out now. So with most students now back in their school buildings, realistically, where is the bar set for the impact that these programs can have going forward? Thank you.
Matthew, I appreciate the question, but Matthew, listen, man. I mean, my buddy, I want you to listen. This is my 21st year at Greenbrier East, and I've almost won 500 games. Limited success? What are you talking about? I mean, for crying out loud, you know. And now 6 of those years I coached the boys and the girls both at the same time. But and I'm just teasing. I've had a lot of great help, and really I love the kids and love being with them. And you know, I don't really go on vacations or do things like that, but I really, other than my family, I really enjoy my time with the kids. It's work, you know, and I want them to be able to achieve and do goodness and everything. But anyway, I'm teasing you. I think I'm teasing you about this limited success deal. But you know, it's been a real honor being the head coach of Game Changers. You know, at my State of the State, you know, last week, you know, I mentioned Game Changers is partnering with the Hazelton Betty Ford Foundation. I mean, that's an amazing step forward. Joe Bozick is doing unbelievable, great work there. You know, if you'll just step back to all the goodness that's going on in our school systems with communities and schools, and I've got to give the First Lady a ton of credit and everything, but we're touching 49,000 kids now, I think, in 29 counties. And I'm going to tell you, no matter what we say to anybody, and I don't mean this in any way because it's Kathy, my wife, but I'm going to tell you, this program, Communities in Schools, is absolutely the best of the best. Game Changers absolutely addressing this situation and us getting ahead of the game and addressing this situation with substance abuse and all the different problems that comes with that. I mean, the whole Game Changers network is just doing just that. It's changing the game, and what an honor it is to be their head coach. And I just think if we continue with you know, the Drug Intervention Institute and the Hazelton Betty Ford group, and all the Game Changer stuff is going on, and all those that are in West Virginia and around, you know, that are trying to really make a difference in children's lives and everything, we're making it happen. We're absolutely making it happen, and you know it, and I know it too. But I don't know about this, you know, partial success or whatever you're talking about. I don't know about that. I don't know if I'll agree with that. Anyway, thanks a bunch, Matthew.
All right, thank you, Matthew. Next to Suzanne Elliott with the Dominion Post.
Yes. Hi, Governor. Quick question. How much longer are we going to be giving out the vaccines? I mean, is there an end in sight, or is this just going to continue to be the norm?
Well, I'll take this. You know, let me tell you the end, okay? The end, in my opinion, would be when every single West Virginian is able to take the vaccine. We just need the number of vaccines. You know, I surely, to God above, hope and pray that there's an end. But we've got to keep on living and doing everything we possibly can to try to help any and everybody we can. And so, with all of that, we've got to be able to stay open. We've got to live with this terrible killer right now. We've got to continue to do everything we can. But is there an end in sight? Well, I hope to God above that there surely is. And that surely has to be when all West Virginians are vaccinated.
All right, thank you, Suzanne. Governor, I'll turn it back to you.
Well, I've got 2 or 3 things, you know, to just touch on real quick here. The first thing is just this, and it is, I mean, for those of you that are out there and you're watching, just imagine that in the last 4 or 5 weeks, the death toll in West Virginia has dropped by 70%. It is amazing what has happened in West Virginia. You know, from the standpoint of the people that we have targeted to get this vaccine, if you'll just step back and think about this just for a second, I think there's 350-odd thousand people in West Virginia that are age 65 and above. We targeted that 75% of them would take the vaccine, and that comes to 276,000 per the great General Hoyer. And with all of that, we have now put in arms 132,000. Well, do the math. That's for all practical purposes half of what we thought would take the vaccine in West Virginia. Now, to tell it just like it is, straight up as straight up can be, we're pushing to get more and more than 75% of our 65 and older people. We're saving your life. If you're 65 and older, you have got to sign up and get your vaccine. We don't want to leave 75,000 people plus that are 65 and older without a vaccine in your arm. The other thing is this. At least the females would always say they're a whole lot smarter than us males in this life. But just think about this. My chart right here says 62% of the vaccines that we've given, 62% female, 37% male. Think about it. And I'm sure, that's rounded, so don't anybody come back and say, well, what's the 1%? But with all of that, let me make it easier. 63% female, 37% male. Come on, male brothers. We got to get you vaccinated as well. You got to catch up. From a standpoint of our daycare, and we absolutely, are going to have more need going forward, we hope and pray, for daycare, and we absolutely need to double check that they are essential and get them vaccinated. But the last thing I'd say today is just this. Our great Dr. Fauci just came out and said that basically we're not, that they recommend we get our teachers vaccinated and move them to essential. Well, for God's sakes a living, we've already done that. Over and over and over, West Virginia has done it, and then CDC weeks later decides, hey, good idea, West Virginia. We're going to do the same thing. Over and over and over. You get the same thing on, hey, West Virginia, good idea. And then they come out and say that's what we're doing. They've also said that it shouldn't be required for in-person learning, if we're waiting to get them all vaccinated. We did even better than that, did we not? What we did is we vaccinated them all before we went to in-person, from the standpoint of 50 and older. So we want to continue to work on that, double back and get the under 50 as soon as we have vaccines available to be able to do that. But absolutely, we continue to be almost the pioneers. And that's what we want to be. We do not want to be Governor Cuomo in New York. We have been transparent in every single thing we've done. Today is a perfect example. We told you we thought we were going to get 7,300 vaccines into Walgreens, and we got 5,800. We told you. We tell you every day. We have pulled the right triggers, and I owe so much to all these great experts that have just done it and done it and done it. We're now at the point in time where we're getting in 41,000 doses, as General Hoyer just told us earlier, in a week. We're making real progress, and the number of vaccines are moving up. We're making progress in our deaths and the number of hospitalized and the ICU units and on and on. But at the same time, we've lost greater than 2,200 people. In fact, we've lost 2,225 people. Please all keep all of them in your prayers. And know, West Virginians, just how blooming good you really are. You're unbelievable. And absolutely, we're going to get through this. We're going to get through it together. We're not going to be New York. We're going to be West Virginia, the star of the game show, the absolute diamond that everybody missed, the envy of our nation. That's you, West Virginia. I've always known you were that. You really are. Thank you.